Hello, my name is Cara S. I'm the Inpatient Educator at Lincoln Prairie Behavioral Health Center, and welcome to Teacher Talk. Today, we are going to be talking about different signs and symptoms of anxiety and depression that you might commonly see inside of your classroom, as well as some accommodations and modifications you can make for your students to best help them and be successful. It is really common to have a student in your classroom who presents both signs and symptoms of depression and anxiety. Some emotional changes include rapid weight loss or weight gain, loss of interest in previously enjoyable activities, loss of interest in friends and family, trouble thinking, low self-esteem, extreme sadness or anger, an ongoing view of a grim life, obsessive thinking about death and dying, and feeling overwhelmed or paranoid. Some behavioral changes might include fatigue, withdrawal, substance abuse, frequent complaints of headaches and stomach aches with no other underlying causes, lack of attention to personal hygiene, angry, disruptive, and/or risky behavior, self-harming such as cutting, bruising oneself or burning oneself, being very fidgety, not being able to sit still, constant need to walk, constant worry, and/or attachment issues. As teachers, we are all aware that we need to provide accommodations and modifications for the students in our classroom. Depression and anxiety do fall under the other health impairments. So let's talk about a couple of different accommodations and modifications that we can make for our students. One possible accommodation that we can make is just to have a calm down corner. These are more often found in our elementary classrooms than they are in our junior high or high school, but it's not always a bad idea to even have one for our high schoolers. Just an area for students to go walk away from the rest of the classroom and take a couple of minutes to calm down. Another option that we can have for our students is to just create an overall plan for when a student gets overwhelmed. They could be overwhelmed with the noise in a classroom, it could be with the people in the classroom, it could be just with the work for the classroom. So always coming up with a plan that's made with the student so that way we're all on the same page. Also helping the student identify a support person that is inside of the school building. This could be a social worker, the school psychologist, a guidance counselor, the principal. It could be a cafeteria worker. As long as you identify somebody who the student might trust and would be willing to talk to, that is option for the student to go to whenever they need a break. Going off of that, if you could also possibly create a permanent hall pass for the students, so that way they can go whenever they possibly need to. That could look like a sticky on the desk indicating that they need to leave the classroom. It could be a clip system where you just clip it off to the side so they know that you're leaving. Anything that you already have for a hall pass system can be modified for your students. Another option for accommodations and modifications is to create a make-work solution. So sometimes with children with depression and anxiety, school just gets too overwhelming, and so they tend to miss school a little bit more often than their normal peers. Sometimes that makeup work that they're looking at once they leave is going to take a lot of their mental effort. So coming up with a plan with them to condense the work into possible, more workable assignments will also be helpful. Another option is preferential seating. So making sure the students are picking a spot in the classroom, whether that's near you to help them be more accommodating and to help them be on track more often, or them picking a spot in the classroom where they feel the safest, where they feel the most comfortable, and where they feel like they can do their best work. Extra time is something that students will often need as well. We talk a lot about test anxiety. That is a real thing that we see a lot with our students here. So coming up with if they can have extra time, maybe they can go to another room to take a test, just something to help ease that anxiety. An IEP or a 504 plan is also an option that you can consider for your students who are showing symptoms of anxiety and depression. It should be considered because there might be a great impact on their academics throughout the school year, and creating that plan now rather than in the future will benefit them greatly. Please remember that everything that we have discussed today is not going to be 100% accurate or effective for each student that walks through your doors. Each child is different, each child is going to react differently and going to act differently in your classroom depending on the day, the weather, and if they got any even sleep last night. So if you would consider these in the future, these might help your students. And you can always reach out to us here at Lincoln Prairie if you ever have any questions. Thank you so much, and we look forward to seeing you next time at Teacher Talk.